Start the clock. The next question, the member for Kingston and the Islands.
Mr. Speaker, in January, this government forced the walk-in clinic in Mallory Town to close after they changed how virtual clinics bill OHIP. It was the only one of its kind in Leeds Grenville. Over 1,000 rural residents were left without another option. In April, a funding application was submitted for a nurse practitioner-led clinic, another option for rural residents. An announcement was supposed to be made in September, and then October, and then the fall economic statement. Crickets. The Mayor just called it a very deathly silence. In the meantime, you've still got rural Ontarians without access to primary care. More people and more complex problems crowd the Brockville emergency room. How many times is this kind of thing being repeated in rural and northern Ontario? Mr. Speaker, innovative ideas for primary care are ready to roll across the province. Why can't this government make up its mind and get rural Ontarians access to primary care?
Thank you. To reply, the Deputy Premier and Minister of Health.
I am absolutely thrilled that the member opposite is finally talking about an expansion of primary care in the province of Ontario, an initiative that our government brought forward and he voted against. So to suggest that we are in any way delaying this expansion is a complete fallacy. We are assessing all of those expressions of interest. And I will say, Speaker, there are some wonderful examples of innovation that we will be able to expand primary care, the first primary care expansion of multidisciplinary teams in the province's history. Very happy to do it. I'm finally pleased that the member opposite is on board and supporting it.
Going to ask the minister to withdraw the unparliamentary comment.
Yes. What? What do I have to do? Withdraw.
Supplementary question.
Speaker, they're still waiting. Now, before I ask my question, the minister is probably going to make up some attack on the Liberal record in her answer to this supplemental question. So let me just say here that the first nurse practitioner-led clinic in Canada was in 2007 in Sudbury, in the first term of a Liberal government. Team-based primary care began in 2005 in the first term of a Liberal government. Mr. Speaker, the government's MPP for Leeds, Grenville, Thousand Islands and Rideau Lakes has been standing up and asking about this critically important rural health care issue in this legislature. So, to the minister, why does the Liberal MPP next door have to fight for health care in rural communities?
Minister of Health.
Well, I don't know. Maybe your leadership candidate isn't going so well. I don't know. What I know is primary care expansion in the province of Ontario is expanding. We are assessing those expressions of interest. We have literally received hundreds of applications. We're seeing innovation. We're seeing partnership. We're seeing community care healthcare centres coming forward and showing that they can help and be part of the solution. We'll continue to do that work. We want to make sure that primary care expansion is absolutely at the core of how we are improving healthcare services in the province of Ontario. But I have to say, Ontario still is leading Canada in the number of people who have connections with the primary care clinician. We're at 90% in Ontario. These are not my numbers. These come from CIHI. But we're going to do better with this most recent announcement of primary care expansion.